welcome everybody to the March Thurston County Board of Health meeting. It's 3:46. We should get started. I believe we have a quorum present. And we have some chickens there at the end. So, can I get a motion to approve the agenda?
I move to approve the agenda for March 12th, 2024.
I'll second. It's been moved and seconded. All those in favor of adopting our agenda?
Aye.
Aye. Any opposed? Abstentions? Cool, we have an agenda. All right. On our agenda, we have an introduction and welcome for one of our newest members of the board, Mr. Ray Peters, who's a representative from the Squaxin Island tribe. He's our tribal representative. Unfortunately, Ray is not here today. If he joins us a little later, I may say a few words of welcome for him, but for now, I'm going to move us on down the agenda. So the next item on our agenda is our proclamation recognizing International Transgender Day of Visibility. So we will read a brief proclamation.
Whereas International Transgender Visibility Day was founded in 2009 to acknowledge and honor the successes achieved by transgender people by U.S.-based transgender activist Rachel Crandall, a licensed psychotherapist and the executive director of Transgender Michigan, and
whereas organizations across the world celebrate International Transgender Visibility Day as an annual day to celebrate the accomplishments and victories of transgender and gender nonconforming people while raising awareness of the work still needed to save transgender lives. And
whereas International Transgender Visibility Day is intended to recognize and celebrate the work being done by transgender advocacy groups as they fight for dignity and equal rights for members of the transgender community, to build inclusive and healing spaces, and to protect and defend those who are most vulnerable.
And whereas Thurston County recognizes the significant contributions made by transgender people and affirms they are vital members of our community.
Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims March 31st as International Transgender Visibility Day in Thurston County, and we urge residents to honor the lives of those lost through participation in community service and remembrance ceremonies. So, normally we would have representatives from maybe a nonprofit organization here today, but they may be running a little late. So we'll say a few words about the why behind this. I think it's worth talking about briefly that the transgender community has been under attack in the legislative and political arena in many places throughout the United States in recent years. There are dozens of anti-transgender bills at both the state and federal levels being introduced. There are even some that were introduced this last legislative session here in Washington State. And sometimes a member of a community or a community may not be sure where they stand with their government. So when we issue a proclamation like this, we are making an affirmative statement that we welcome the transgender community, we recognize their value and their contributions to Thurston County, and we want them to feel safe here. So that's why we put forward this sort of proclamation. It's just a statement saying, you're here, we know you're here, you're a member of the community, you're a part of our community, we want you to feel like you belong. So I'm glad we're taking that stand. We did this last year and we're doing it again this year. So thank you, everybody. Next up on our agenda, opportunity for the public to address the board. Is there anybody signed in for public comment? Is there anybody online signed in for public comment? Well, seeing none, public comment is now closed. Moving on down, we're moving fast on this agenda. I thought we were not gonna have enough time. I think we're gonna have enough time. Okay, next item. Fiscal Subcommittee. So during our last meeting, we talked briefly about the opportunity to serve on the Fiscal Subcommittee, which is the smaller group that provides input on the budget. for the public health organization. And now, I would invite nominations, if you are interested in serving on the fiscal subcommittee for the Board of Health. Would really like to hear from you, or if you'd like to nominate somebody else. Hopefully you checked with them first, but you are free to nominate people on the board. We can have as many as 5 members on the subcommittee without violating our quorum rules. So I'm gonna be quiet and open it up. Who would like to serve on our fiscal subcommittee? Commissioner Mejia.
I would just like to encourage our newest members to participate on the financial subcommittee. It's a good way to kind of learn about the Board of Health from a different perspective, which is from the financial aspect of it, so, and it's a really good subcommittee to be a part of.
I hope that our 2 current members
I was like,
Stay.
I'm happy to nominate anyone.
stay as current members, so, yeah, if you wanna.
Just
As long
self-nominate.
as long as no one else wants to take it, and then as long as you put up with my annoying showing up late all the time.
Absolutely.
It would be great if we had at least 3.
I would like to do it as well.
All right, Commissioner Klaus volunteered, and Board Member Zenzali Marshall. That's 4. I'll do it. Perla?
Yeah.
All right, well, I can't see your last name, I'm sorry. Board Member Perla. Okay, that's 5. So we have 5 individuals who have been nominated or volunteered to serve on our fiscal subcommittee. Are there any other nominations? Are there any other nominations? Are there any other nominations? Seeing none, nominations are closed. We have a subcommittee of 5 members. Thank you very much, everybody, for volunteering.
We will work with you all on getting, a cadence that's not gonna be 7:30 in the morning every other week, which was what we were doing last year because of the budget, so. We got you.
So look to David for more information about scheduling those
Yep.
meetings, but thank you for being willing to serve. Okay. Next item on the agenda, last meeting, we talked about our proclamation calendar. So we reviewed it last time. I wanted to give folks a little bit more time to look at the calendar and just come prepared to talk about whether what we have currently on our list for Board of Health proclamations is what we want 2024 to look like, or if you had suggestions or questions about what's currently on here. David, did you want to add anything?
Nope, just as a reminder that, I believe was highlighted in here is what the board did last year, which again, not to prejudice your thought process, but just to know it's what happened last year. Yeah, excited to see what you guys choose.
Does anybody have any comments, requested changes?
I was gonna say one suggestion, because I know this is overwhelming, could be if you like what happened last year, you could vote on the calendar as last year with maybe adjustments, right? So you could go with this calendar, but then maybe you're changing October, you're changing.
Amend the schedule
Yeah.
for just October.
Otherwise, it might get complicated trying to vote month by month. Just an idea.
I think last month, we talked about wanting to recognize homelessness as a public health issue.
Yep.
I think October was the month that might fit in. Why don't we go month by month?
Good idea.
How about April? So currently for April, we would be recognizing Prescription Drug Take Back Day. And if you look at our topics highlighted page, there are these other options, so awareness topics, there's also April is Sexually Transmitted Disease Awareness Month.
So that's not on our.
Yeah.
I didn't see prescription drug.
It's on the first page for
Look at the
what
top,
we did last
so
year.
it should be.
There it
We're
is.
looking
That
at
is
it.
Because there's
nice.
Board of Health on the
Yep.
top, and then there's Board of County Commissioners down.
These were all
the
just
second
these were all
page.
just like other possibilities with the blue.
Oh.
This is kind of the default, is the top,
Okay. Thank you so much. That was really good.
And then
So-
I can say that on, like, you'll see on the board, in the second box is Board of County Commissioners Child Abuse Prevention Month, which is on our list, but the board is doing that again in 2024, just
Commissioners.
commissioners, yeah, the Board of County Commissioners.
And so do we not want to duplicate? Is that the idea?
Yeah, we wouldn't want to duplicate, I wouldn't think.
Thank you.
There's so many topics.
That way we can cover more ground.
Yeah.
So for April, we also have Sexually Transmitted Diseases Awareness Month, National Child Abuse Prevention Awareness Month, National Volunteer Appreciation Month, which I think is what the
Also doing that one, yep.
Yep. And then Sexual Assault Awareness Month, Sexual Assault Awareness Prevention Month.
Would propose we consider Sexually Transmitted Diseases Awareness Month, because I think we are starting to see a lot of syphilis and things we haven't seen in a long time, and lots of chlamydia. And so maybe a little focus on that would be important for the community.
Okay, so instead of Prescription Drug Take Back Day, swap out Sexually Transmitted Disease Awareness Month. Okay,
And the board could still acknowledge Prescription Drug Take Back Day. Like, the proclamation could be about STI awareness, right? But then you could still, if you decide to, you could still take a moment in the meeting to note that, you know, that's a day that month. So folks don't feel like we're losing out on.
yeah, and in fact is an ongoing program that a lot of different partners are working on across the county. Okay. So we have STI awareness in April. Anybody got any other thoughts on April? Kind of moves on to May. So currently, May would be National Nurses Week. But we also have, there's a lot of topics for April. I skipped over some of them. But if we look at May, Make May Purple, Action on Stroke Month, National Walking Month, National Clean Air Month, Asian Pacific Islander Heritage Month, Maternal Mental Health Awareness Week, Composting Week, Public Service Recognition Week, which is, Children's Mental Health Week, National Nurses Week, Sun Awareness Week. I feel like that's too early for Washington. And then World No Tobacco Day. Carolina?
I'll be, with kind of the statistics on maternal mental health and the high rate of, suicide rates and death rates that we're seeing, and,
Postpartum anxiety and
postpartum,
depression.
yes, I'm, kind of leaning towards some maternal mental health awareness week, because those statistics are kind of fresh in my brain at least. But I also want to appreciate all of our nurses, especially here, who work for public health and social services, so,
Do both.
We will miss the Maternal Mental Health Awareness Week, right? Because the week is the 1st to the 7th, and the meeting is after that. Not that it's not doable, but you kind of missed that element of getting people, our meeting would be on the 14th. Just in case that matters to anybody.
Well, then we also missed National Nurses Week,
Yes,
so we missed both of them.
yep.
But nevertheless, we could issue a proclamation recognizing the importance of supporting maternal mental health or supporting nurses,
Or both.
or both.
Yeah, I also agree. Maternal mental health is really important. It's very often undiagnosed because people don't know how to advocate for themselves or what to look for in signs of advocating for others. So
Okay, I'm hearing some, a coalition around maternal mental health. So why don't we make that our topic for May? And we will frame the proclamation recognizing that there is a specific week. It will already have passed by the time we issue it, but that it is important as an ongoing public health issue for Thurston County.
And the county does a lot of work around that too.
Yes.
They could share resources and highlight.
And I notice, Commissioner Fournier has joined us online, so welcome, Wayne. I saw you pop on. We're currently reviewing the proclamation schedule for 2024.
I think you left.
Thank you.
Oh, I think he turned his camera off. There it is. Okay, how about June? So currently, for June, we would be recognizing Food Safety and Composting Week, which is the 5th through the 11th. Again, we'd be missing a week by the time we have the meeting, but that's not a big deal.
My plug for that one, I think last time was recognizing that we don't have a lot of monthly proclamations related to environmental health topics, which is not to say that you guys can't do something else, but just noting that that's kind of the one. When I look at the last year's calendar,
That's the
that was the only
environmental
one that
health.
had any kind of EH
Yeah.
on it. So just
Okay.
There's actually a World Environmental Health Day.
in June.
Yeah.
Is that a proposal?
Is that to what they have to say?
Anybody have any June?
My vote would be to focus on environmental health.
Okay. We want to leave our current topic, the Food Safety and Composting Week? Okay. Excellent. Moving on down the line.
Commissioners do Pride Month, just FYI.
Yeah, so Pride's covered somewhere.
Maybe Earth Day.
Yeah.
Earth Day. Just to kind of another
Perfect
touch
time
on
for
environmental.
food safety, right before the picnics.
Yeah, as the weather starts to get warmer.
Pop-ups.
Think about how long you've had that potato salad out. We move on to July, we don't have a meeting, so no opportunity to put forth a proclamation if we don't get together. We're looking at August, and August last year, we had 2 topics. We did both National Breastfeeding Month and National Immunization Awareness Month. Both solid topics. Other awareness topics in August, National Road Victim Target Zero. And International Overdose Awareness Day.
We have done International Overdose Awareness Day in the past.
Looks like the
Was it
commissioners are
last year?
covering it.
Okay, there you go.
It's on the list for,
Commissioner Edwards' hands up.
okay. Commissioner Edwards, go ahead.
I just caught the last part of what you said about breastfeeding. Did that get on the list?
We haven't taken it off the list yet, so it's, yes, it's still on there.
Okay, I just wanted to point out that before COVID, the county actually started a pilot program for breastfeeding mothers where they could bring their kids in. And so I'd like to, besides, I think it's very important to recognize that issue, giving kids that early start, if you will. But I think it's worth thinking about coming up with some kind of a policy, maybe to at least study that again, to see if that isn't something worth doing.
So I think what you're talking about is bringing your infant to work. And I know a lot of state agencies have existing infants in the workplace policies, and they have been very successful. So I think the county has started a program like that. It may have gotten tabled during COVID, like a lot of those policies did. But yeah, it's one of those things that can definitely help form that breastfeeding bond between infant and mother. If a mom has to go back to work, that can bridge that gap.
Yes. So anyway, I just wanted to make sure that I would guess I'm voting that we promote that. That's what I'm pushing here. Thank you.
All right. We've got a vote for keeping National Breastfeeding Awareness Month on there. Does anyone, I'm fine with us keeping both of the topics because I think immunization awareness is another, continues to be an important topic.
That's a really good time of year to do it.
Right before school starts again,
Yep.
yeah. Okay, so we've got 2 topics we're gonna keep on the list for August, National Breastfeeding Month and National Immunization Awareness Month. In September, currently we have Suicide Prevention Awareness Month. We also have National Healthy Aging Month, National Preparedness Month, National Sexual Health Awareness Month, Recovery Month, Alzheimer Month, Reproductive Health Month, wow, September's got a lot going on. Food Safety Education Month, and National Hispanic Heritage Month. Let's see, the Board of County Commissioners is covering Day of Service and Remembrance, National Hispanic Heritage Month, and Voter Registration Day in September. So, do we want to hold on to Suicide Prevention Awareness Month? I know we've got a lot of activity and programs around the state right now designed for the prevention of suicide, 988, the tribal work that we're doing in that space.
The data that I've seen for Thurston County, particularly our youth, when it comes to suicidal ideation is concerning compared to statewide numbers too, just an ongoing issue in the county, so.
Okay. Okay, well, let's keep that one then. So moving on to October, which is National Children's Health Month. Other items on that list is Breast Cancer Awareness Month, Domestic Violence Awareness Month, Health Literacy Month, and National Dental Hygiene Month. And then a whole nother list of Global Hand Washing Day, National Mammogram Day, Prescription Drug Take Back Day. There's a day for prescription drug take back also. Flood Awareness Week, and then Mental Health Awareness Week. Does anybody have any strong feelings? Would we like to keep National Children's Health Month as our October topic? Any recommendations for other topics to cover in October?
You said something about a homeless related one?
Oh, yeah, just skated right past you. You gotta speak up. All
Oh,
right.
sorry, I was like overstimulated. There are so many things on this
Yeah,
list.
me too. There's a lot. Thank you for the information, whoever put this list together.
Yeah, I do recall this was the month, I believe, that we talked about.
Like homelessness prevention
Yeah.
month or something on that topic. So let's add that. I'm comfortable with us having two topics for the month of October. So let's add in October, homelessness prevention.
Was it homelessness prevention, or did we find that there was actually a national awareness day of some sort?
World Homeless Day on October 10th.
Okay.
Oh, cool, it's on my birthday.
World Homeless Day. On that day that we have the meeting, that's great. Okay, so we'll have two topics in October, National Children's Health Month and World Homeless Day. And then we do not have a meeting in November, do we? No.
We don't usually because it conflicts with the Wasp County Conference, the WASAC conference. Isn't that why we usually don't have a meeting?
Usually, yeah.
In November, yes.
Yeah, there's not a planned November meeting.
Okay. So November will be an off month for us. And then December, currently on the list, we have National Impaired Driving Prevention Month.
Kind of like the idea of the National Family Caregivers Month, because there's so many different iterations of that. We have all these grandparents caring for children, we've got family members taking people in, we've got people caring for elderly family members or injured, and I feel like that goes unrecognized, that labor.
Yeah. Okay.
Yeah, I'm with Dr. Harvey on that. It happens quite a lot in our community, and there's not a lot of support. It is really unrecognized, and I think just the acknowledgement for family caregivers is really important.
I feel heavy and lonely. Okay, so December we'll recognize National Family Caregivers Month.
It's good to have a couple new ones, I think, too. Sure. I don't remember everything.
That's listed under both November and December. Did you mean December? Family caregivers month is listed
If I said November, I meant December.
On the list, she's saying it's on November.
It's listed under both, and I thought we were talking about November.
We don't have a meeting in November.
Oh, open meeting.
Oh, so maybe we need to.
Yeah, it is, it's listed in both places.
Yeah, I wonder which month it actually is.
I looked it up online, it is in November.
But we can still recognize it, since you're not having a meeting.
Yeah. Yeah, let's stick with that topic. We'll figure out a way to talk about it, even if it's not the right month. Okay. And is it worth us talking about our January and February topics, since we're making the decision on the calendar in March?
I think it's worth at least getting your January one.
Okay. Let's go back to January. So, January awareness topics, National Blood Donor Month, National Human Trafficking Awareness Month. I know that's something that the county has worked on. National Law Enforcement Appreciation Month, National Birth Defects Awareness Month, Sexually Transmitted Infection Question Day, Martin Luther King Day, and Parent Mental Health Day. I think we're covering maternal mental health in May. Does anybody have any recommendations for a January topic? It's wide open.
It's not illegal to have a meeting without a proclamation, just saying.
Noted. We could just have an open.
Thank you, Commissioner Menzer.
Or- Yeah, go ahead.
The Human Trafficking Awareness Month, I think that one would be important if we're gonna have a proclamation.
Yeah, and I think the Heidi, who's not here.
Nadel?
Yeah, I think you said she was interested in that too.
She requested it last meeting.
Okay.
Okay.
Well, January will be National Human Trafficking Awareness Month. How about that? Okay. Any other thoughts or comments on this topic?
I have one.
Go ahead.
Today's proclamation, you mentioned we usually have a nonprofit and we didn't know if they would show up today. Did we have a nonprofit or a group set up to come in today?
Yeah, do you want to tell who we reached out to?
3, actually. I think.
I will pull up my list very quickly. I invited, let's see off the top of my head, PFLAG, the State Commission, LGBTQ Commission, Pizza Clutch, the City of Olympia's Social Justice Commission, the City of Lacey's Commission on Equity. It was about 5. Also, Tracy, what is it, Soul?
Yeah.
What does Soul stand for?
Sage.
Sage. No, not Sage, Soul, the older.
Yeah, that's what I was talking about with
Okay.
Sage. They may have changed their name,
Yeah.
but that's how I know
We
them.
had
I had it in
five
my
or
notes
6
to you.
people that I reached out to. I did follow up with a few of them, and 3 of them said that they were coming, but something
They
must have
did.
happened. So, I was,
Yeah.
The Sound Alliance of Older LGBTQ. That's what it is.
Okay. It just feels like a half-hearted attempt if we don't have anyone here to speak, or we didn't get up to take a photo and no one made any comments. And except Robin, you did, and I really appreciate the comments you made, because this was it's been a really hard year for our LGBTQ community, particularly transgender members of the community. And even in a state like Washington, where a lot of people think we're a progressive state, and we did have some anti-trans bills this year that did pass. So a lot of concerning things have been happening in this area. We've got youth being killed by their classmates in our country. Even in our state, there's a lot of violence towards youth in our schools who are transgender or gender nonconforming, non-binary. So it just really kind of hits hard to not have anyone here to speak on this topic. And I'm wondering if we could like try again, maybe, add it on to next month if possible, and see if we could do another reach out to the groups again. I know Stonewall Youth might be interested as well.
They are on my list, and I did not get a response from them. I also contacted Planned Parenthood of Greater Northwest Hawaii and Alaska, and I did have back and forth with them. They were going to invite their youth council, but I didn't have any response from their council.
I think it's a great idea. I think we should absolutely.
Maybe we can identify a speaker and invite them to give us a brief presentation during April's meeting.
There's no reason why we shouldn't. I think we should absolutely invite them to come back again next month.
Tracy?
Can I also add, when we talk about Day of Visibility specifically, it is not a day to do any kind of remembrance. It's a day to celebrate the transgender community and see them as not victims. And so I want to bring that up because we've been talking about all the problems they have, but the day is specifically designed for the opposite of that. So I just want to acknowledge that as an activist myself in the LGBTQ community, that it is important to remember that they're human beings, not just victims. And that's what this day is about.
That's a really good call out. Thank you.
Thank you, Tracy.
Okay.
I could also help if you need, Linda. I have connections with Stonewall and I could reach out to them and see if they're interested, but it sounds like you've got plenty of people to reach out to, but you can let me know if you'd
I
like.
would appreciate it, because I agree. I think what you said is very important.
Thank you. I appreciate that.
Okay, so we will have a speaker hopefully lined up for next meeting. David?
Probably need a motion to approve what you guys.
So ready.
Okay, very good.
So I would entertain a motion, I'm gonna read all the things that we just decided into the record, that we approve the Board of Health proclamation schedule for 2024 and the beginning of 25, so that in March, we covered Trans Visibility Day, that was today. April 11th, we will recognize STD Awareness Month. In May, we will recognize Maternal Mental Health. In June, we'll recognize Food Safety and Composting Week. In August, we've got a double header, National Breastfeeding Month and National Immunization Awareness Month. In September, we will recognize Suicide Prevention Awareness Month. In October, we will have another double header, National Children's Health Month and World Homeless Day. And in December, we'll recognize National Family Caregivers Month. Then in January of 2025, we will have a proclamation on National Human Trafficking Month. Can I get an official motion? All you have to say is so moved.
So moved.
Second.
It's been moved and seconded to adopt the amended Board of Health proclamation schedule. Any comments? Good job, team. All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? We have a proclamation schedule. Thank you, everybody. All right, we're gonna move on down to our next item on the agenda. I believe I'm gonna pass the microphone and the speaking privileges over to Dr. Jen Freiheit to take us through, where did she go? Oh, there she is. She's coming to the podium to talk to us about the Board of Health Strategic Plan.
Yes, so hopefully you saw the email, I had forwarded it out. I only received a couple of minor edits, but I definitely think it's still something worth discussion. So took all of your comments from last time, gathered in some of the things you were talking about, stewardship, we wanna make sure this and that is in there. Found places for it. I don't propose that it's in perfect shape, but tried to sort of break it down. The last 2 pages are a work plan, so that is something that your new Board of Health clerk, Jacqueline Gilly, who's back there, will help carry forward each month. And so I think that's where really the meat of what needs to be untangled with all of you needs to happen. So that's really it. I threw a draft together, received a couple of edits. What you have in front of you are not those edits. I know Ms. Newton had a comment for discussion that you all can talk about, and then I'll make any edits you want. And get those for you. That's all.
Perla, do you want to lift up your comment?
Yeah, I thought this was all really well put together, and I really enjoyed reading it. So, my only question to the board was for the mission and vision, do we want to actually include the word community in any part of that? Is it assumed that's who our audience is? Is that, worth, mentioning specifically? That was it, yeah.
Like, would you want, like, for the community at the end of the statement?
Of the mission?
Yeah, like, where do you see it fitting in, or?
Yeah, that,
Like,
go
would
ahead.
you want to word gobble
I
again?
think, I was thinking it could replace generations to come, if you wanted. Supporting our community by optimizing equitable access to health systems, resources, services, and partnerships through data policy and education.
Yeah, and again, I'm not saying it's necessary. I was just wondering how you guys felt about it, so.
I would like to, like, and I just want to be like really like straightforward when I ask this. How much time do we have for this evening? I'm being very serious because I'm very open to actually talking about it, but it feels like there's a little bit of urgency in getting this done and completed. So I definitely want to be a team player, but I also really want to honor how others feel about the wording and actually kind of talking through some of it. So,
We have time.
okay. I really like the generations to come. I am all about adding community somewhere because that does make sense. It feels like it might tie it in a bit more, but I really like the generations to come because it puts a little weight on, for me, when I read that, like there's weight to the decisions that we make here, so, and how that affects people to come. So I do like that.
I agree with that.
Could it fit in the vision statement? Empowering all people in our community to lead healthy lives? Doesn't make it too much longer. I know the goal of the vision statement is that it's concise. Because I do like adding community.
Supporting our communities through generation by,
Is there a
generations to
synonym for
come.
generations to come?
That's a good, right, like, I'd love to, I don't want to Google
That
it.
captures the intent.
I would love to hear from Wayne and Gary as well. I don't know if you guys have it in front of you or not,
Yes, I'd throw something out here.
please.
I think maybe something like supporting our community by optimizing equitable access to health systems, resources, services, and partnerships through data, policy, and education for generations to come.
That was going to be my. I think you can fit it all in there just pretty well, like Commissioner Edwards just stated.
I like that.
Okay. So we move the clause generations to come to the end of the sentence and put supporting our community by.
Supporting our community by making multiple proclamations.
Hey, man. There will be no question what we stand for. Okay.
So the vision would be left as is, right? Yeah.
You could say future generations.
I have a question about.
Yes, that we're talking about the future. I agree.
You don't have any statistics to share, do you, Commissioner Edwards?
Well, not right now. But I've lived in the past and I've got just a little bit of future left, so.
My question on the vision was, I can't remember where we left off with it last time, but is this where we left with it last time, or did you make any adjustments?
Nope, the vision was exactly as was left. The mission was the one that we kept sort of rearranging.
Okay.
So I took a stab at it, and yeah, you can red ink anything in here, but the vision was exactly as it was left.
I feel like I remember, I know we had a lot of back and forth last time, so my memory probably is gonna fail me at least a little bit, but I feel like I remember a conversation about like wondering what we mean when we say lead healthy lives, and I don't remember where we left off on that note. I don't know if anyone could jog my memory, if we decided to settle on that or not.
It was a slightly different wording at the time. I think it was a little more vague. Optimizing, I forgot the exact wording.
Optimizing, we kept going back and forth on, so we never really settled whether we used that word optimizing or not.
Commissioner Edwards?
I guess if I had the opportunity to make a change, I would say empowering all people to lead healthy and productive lives.
I don't know if I like the word productive in there. I think as the Board of Health, it's important for us to realize that that's a subjective word. And I don't know, I'm open to people disagreeing with me, but I feel like if we throw that in there, it kind of is implying that like, we know what that means.
The word empowering is.
Yeah, my memory.
I think,
I was just gonna say, my memory was that you guys ended up with Lead Healthy Lives was the compromise from a lot of different iterations. But I don't remember the specifics of like.
Yeah, neither. There was a lot.
There was a lot, that board was working. But I remember that we ended up with Lead Healthy Lives was the one that people kind of could live with, if you will. But there were different iterations of that. I don't remember offhand.
It might just be me, but the word like empowering, it just doesn't. It doesn't really sit kind of like in a vision. And I'm
Sounds
trying
like
to,
a mission to me.
yeah, it just doesn't,
Yeah, that makes sense.
The vision would be people empowered to lead healthy lives. That's the vision. The mission would be empowering them to do it. So that's just a little bit of a grammatical change, but.
Where does the action word live in the sentence?
Yeah.
Yeah.
Makes sense.
so people empowered to lead healthy lives. I like
All
that
people
better.
empowered. I will remind the body that this does not have to be perfect, because it's a 2-year plan.
Yeah.
And it's just a sketch of what it is we're doing here. We don't need to fall into the trap of like needing to get the language perfect. I think it's pretty good for the hour we spent on it last
It's
month.
amazing, it's an amazing work.
So what I've got for our little tweaks is supporting our community by optimizing equitable access to health systems, resources, services, and partnerships through data, policy, and education for generations to come. That's our mission. And then our vision, sort of tweaked, is all people empowered to lead healthy lives. Could we live with this?
That's what I'm talking to myself about now. I could live with that.
Yeah, I think that sounds great. Yeah.
Okay. Do we need a motion to adopt the strategic plan? Are we quite there yet? Are we gonna see this one more time?
I would, if you wanted to adopt something, I would say maybe adopt for now the vision and mission. But I think that the rest of the strategic plan, especially that work plan part, needs some tweaking. It needs because this is the strategic plan for you, the 12 of you. What do you want to achieve in the next 2 years? What do you want to do? So I took liberties to try from the different things you all were saying, but I took liberties.
That's fair,
So
we should review that before we agree to it.
you should review it.
Let's look at what we're signing.
Always a good idea.
Hey, Jen.
I think, I did Yeah, I think I sent you one adjustment, in communication, that word tenant.
Yeah, and this doesn't reflect any of the changes that I received.
That's okay. What was the question I had? I'm curious about the strategic plan living process. So the idea is that if we're gonna bother to have a strategic plan, that it not be a thing that gathers dust on a shelf, right? So how do we keep it fresh and actionable? So we will meet as an entire Board of Health monthly. These meetings will include a standing item of critical reflection on each component of the strategic plan, as opposed to just a report out on our progress by the board clerk. Jen, can you talk a little bit about what you think that would look like for us?
Yeah, so however you want to roll that out, my thought was just like you have the director's report or Dr. A's report, that you would have strategic plan report that your Board of Health clerk would report out on. And depending upon what goal or objective you're working on that month or that set of months, that it wouldn't just be a report out of, well, we've achieved X, but it would say, depending upon the goal, let's discuss how we want to move forward on this, that there would be some actionable discussion, reflection on what to do.
But it wouldn't be every item on the list, it would be specific
No,
items
whatever, however
or
you want to
one.
set that up. In that work plan, and again, I took liberties saying, maybe that's something that could get done by December or October, and I just threw them on. Please change it. But that's where it would sort of be bound by whatever timeline you set to things.
I like the idea of the components of the strategic plan, like the goals that we're working toward being inserted into the work plan, so that we have
Exactly.
dates
It has the
when we
strategy
review
at the
them.
top, which your strategies were data, policy, and education, essentially summed into those three
Yeah.
words. Then the goals that you chose, and then SMART objectives, timeline, resources needed, all of that.
Team leads will determine assignments and number type of subcommittee meetings if necessary. Are the team leads Board of Health members or county staff?
I just was throwing in words, so I know that there has been discussion in the past how you have the fiscal subcommittee, you might want other subcommittees, so essentially that's what that was getting at.
Okay. And I like the fifth bullet point down where we talk about developing a newsletter to share the progress toward the goals. Like communication is one of the things we said we wanted to focus on for a value. So
Yeah.
getting the word out of the good work that we're doing.
And then you had a specific goal around visibility, so communication obviously fits right into that one.
Yep. And we talked about a lot of things wrapped around communication, like developing trust and credibility in the community. So I think that goes in that direction.
And I was trying to import equity things around each of those goals too, so that equity was woven throughout and not just like a goal.
For the last bullet point on page 3, at the end of the 2 years, a formal presentation of the community will detail the successes and lessons learned from the strategic plan and its process. So are you thinking that would be a regular Board of Health meeting or a special meeting or a community forum?
Or a report, or I was just thinking at the end of the 2-year time, or maybe a midterm report or something that your Board of Health clerk can put together. Here's the success, here's what we've done, and
Yeah.
talking points to, anything from talking points to a report out at an actual Board of Health, or just a report to be distributed to the community, whatever you think. But holding accountable, if you will, to putting it out there.
Instead of just setting goals and then actually letting
Sharing it.
folks know whether we got closer to them.
Yep.
Yeah, I like that.
I think I appreciate the wording of these bullet points are broad enough that you all have flexibility about the style or the means of like it just gives you some direction, but you're not tying yourself to today to like we have to do it exactly this way, but it gives you
Absolutely.
these sort of milestones you want to hit and what you want to do with it. But as we get further down the year, you might decide a report makes more sense than a special meeting, or maybe you want, it's just, you're not tying yourself to specific things here as much as you are these sort of key milestones and key things you want to hold yourself accountable to, so.
Jacqueline?
Comments?
Not yet. I'm kind of just trying to absorb at this time, but no, not.
On strategy 3, under strategies and goals, goal 3.1, because it's talking specifically about communication and just having good information, making sure the public has good information from us. I was wondering if we should just specifically put in that it's to build public trust.
Where?
Anywhere, maybe in that last sentence. It is imperative that the public have an accurate perception of the role and services of public health and/or public health and social services department to promote public trust, or because that is one of the main reasons we're trying to communicate, and that's a goal of that communication.
What if we put it at the beginning of that sentence?
Yeah, we could.
To build public trust, it is imperative that the public have an accurate perception of the role and services of public health. Okay, so we can sit with this and continue to talk about it, but do folks feel comfortable perhaps finalizing our mission and vision?
And it's a living document, so yeah, as that section on living document, your Board of Health clerk can keep bringing that back and say, okay, let's form another committee, or, you know, to deal with the goal, the next goal, or the next timeline thing, and so it will obviously be edited and changed throughout the 2 years.
Does anyone want to make any motions?
Sure. I would move to approve the strategic plan.
Mission and vision?
The mission and vision of the strategic plan for 2024 through 2025.
There's a motion and a second to approve the mission and vision statements in the Board of Health strategic plan for 24-25.
In the edited version.
Yes, the amended version of the mission and vision. Any comments? Any discussion? Seeing none, all those in favor, please say aye.
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 Any opposed? Any abstentions? Seeing none, we have a mission and a vision for the Board of Health. Thank you, Jen, for your help.
I'll make all the edits, I'll resend it out to all of you. You can just continue.
So are we gonna work on values next meeting? Is that the idea? I mean, how do we deal with the rest of it? We just covered that much.
How about we send out an updated version with, like, incorporating some of the feedback you got, and then we can put it on to finalize the rest of it at the next meeting.
Yes, there were some edits to values, just wording changes that I think you probably all would approve, but I'll add those in there and then, resend it out.
Okay.
Very good.
Narrowing down what we need to work on next time. Okay. Next up on our agenda, I believe we're gonna hear from Dr. Abdul Malik.
Good afternoon, Board of Health. I did want to share a little bit of information for all of you. So we continue to be below the minimum alert thresholds for COVID-19, influenza, and RSV, which is good news. We also continue to have low hospitalizations for COVID-19, which is the CDC marker that they're tracking for counties. So for the week ending March 2nd, we're at 1.9 COVID-19 hospitalizations in the preceding 7 days per 100,000 population, which is pretty good. This also concurs with our wastewater concentration. So the LOT system does do wastewater surveillance for COVID. And we've been seeing downtrending concentrations of COVID-19 in our wastewater as well. And I believe the most updated data as of when I checked this morning was February 28th. So as far as the variants that we're seeing in Thurston County, the dominant variant continues to be JN.1, which is an Omicron subvariant. And this is pretty much in alignment with what we're seeing across the country at this point. The good news is that we're not seeing a spike in severe illness or death. So we continue to watch. The CDC did release updated guidance for the general public, not healthcare, which didn't cover the healthcare setting. So in terms of the hierarchy of guidance is first our federal partners make a determination, then the State Department of Health makes a determination for Washington State. And so we're part of the stakeholder process for that guidance. And so once the guidance is determined for the state, then I and our team here look at the situation in Thurston County and then determine the guidance for our county. So more to come there. And we're happy to share out the guidance once it's been fully fleshed out. But at this point in time, we're still waiting for the State Department of Health to make determinations. I also wanted to share that our statewide levels for influenza-like illness is low, and that the dominant strain of influenza that's circulating continues to be influenza A. I also wanted to share that that we as Thurston County Public Health have been able to have a self-service testing kiosk. I believe it's in Tenino, and so and it provides no-cost COVID-19 test kits as well as influenza testing as well. The placement was determined mostly by looking at where folks might have more challenges to access testing. So that's something that's pretty exciting for us. As far as vaccine, the Advisory Committee on Immunization Practices, so ACIP, recommended an additional dose of the 2023-2024 COVID vaccine for individuals 16 and older. So most folks should have at least one of the most updated vaccine, and then folks 65 and older are recommended to receive a second dose 4 months after that first dose. Folks who have immunocompromise and are age 65 and older should receive an additional dose, but that can be 2 or more months after that first dose. So just a little bit of a guidance update there. Looking forward to the 2024-2025 vaccine and season, that we're still waiting for the Advisory Committee on Immunization Practices to make some of those determinations that we're expecting in their upcoming, at least we're expecting some additional information in their upcoming meeting, which I believe they are anticipating, if nothing changes. We anticipate that would likely be their June meeting if nothing changes. So we're keeping tabs on that. Just a reminder to folks that folks are still experiencing severe COVID and experiencing severe illness, including hospitalizations and death as a result. Statewide, only 18.1% of Washingtonians are up to date on their COVID vaccines. So just wanted to take a moment and highlight, the importance. As of when I checked our state data this morning, there have been approximately 700 deaths attributed to COVID this season in Washington State. So, so this continues to be a matter of some importance.
When does the season start? When do they measure?
So so respiratory season, so week 1, it's like October 1st, like that first week.
So, obviously COVID stuff was highly politicized, and I'm just wondering now that we're kind of moved out of the, highly political phase of it, are people going in and getting is it still people like saying, oh, I'll have all my vaccines, but I don't want that one? Like, is that what's going on? Or are all vaccination rates falling, across the board? Or what does that dynamic look like today in terms of people's attitudes about just state, typical vaccines that they'd be normally getting for them or their kids?
So I can share that we do have lower vaccination rates than we had pre-pandemic for other vaccinations, not just COVID vaccine. And I was gonna reach out to Dr. Harvey.
Yeah, I think we're seeing a generational shift as well. So the littler kids, the 6 and under rates are lower than people older than that. I have found I've had definitely more hesitancy around measles, even though we're seeing measles. And that's my biggest concern. That's what keeps me up at night, I'll be honest. I feel like parents don't seem to be afraid of COVID in kids as much, which does match sort of how they're doing pretty well. And so I've had a lot of people, I think, do more flu this year than COVID, which has been interesting as well. But I definitely am watching our rates. I'm very concerned, especially like why are the younger parents with younger children sort of opting out more? And there's got to be something going on, and I suspect it's where they're getting their information from, perhaps, or things like that. So just from conversations with hesitant parents, that's what I'm gathering.
That's what really worries me, is that the long-term impact of the politicization of the COVID pandemic has resulted in like a long-term distrust of medical science and vaccines. And that's really scary. And like, that's why it's so important that we build trust.
Well, and I think as a person who's old enough to have cared for measles and things, like I've seen basically everything but diphtheria, and these things that we're preventing are horrible, and that you would take that risk that your child might suffer that versus you're so afraid of a vaccine that you're not afraid of the disease is really interesting.
Well, because you haven't seen the disease, because we essentially wiped it out, you don't recognize how big of a risk it is. It doesn't seem like a risk.
Yeah, because when I was in residency, we had a measles outbreak in a polygamy community, and there were so many kids in the ICU, and I cared for kids with measles. They're miserable, and the mortality rate is 1 in 500 to 1 in 1,000 kids who get measles. So if we start having outbreaks, that's going to be horrible. And like deafness and things, it's like there's horrible outcomes from that. And then I'm old enough as well. The things that prevent meningitis were developed when I was like in med school and residency. And like when I was in med school, I was doing like 6 spinal taps a night when I was in the ER. And then residency, I was doing like, maybe 1. And then like I haven't done one in 10 years. So it's impressive how well they work and preventing suffering. And like, I don't think people understand what it's like to have your kid in the ICU.
I had a childhood friend who died from meningitis, so, yeah.
Yeah, so I think any way we can kind of like help people understand the choice they're making, and then also the safety of like, this really is a safe thing you're doing, and how to assess risk like in a more rational way, I think would be helpful.
Did you still have?
No, I was just hoping it was like, I was hoping it would go the other way, right? Like, as COVID just became one of the regular vaccines that people do, and people were not gonna not do what they'd done before, it would then just sort of fold into people's prior attitudes about vaccines versus the other way, which is eroding people's confidence in vaccines that they had confidence in before, like,
Well,
that's
it's
not the
been-
trend I wanted to
It's
hear.
been eroding for a long time.
Yeah.
And I would say the autism thing was the start of it, where it really got bad. Yeah. So anyway, I'm sorry. I
No
interrupted
worries,
you.
and this is kind of all related, so, you had said there's 700 deaths attributed to COVID. I just want to clarify, because I don't know if those two terms, so do cause and attributed mean the same thing in like allopathic language? Like, you know what I mean?
Yes, there's specific criteria for determining whether or not a death was due to COVID. That has to do with testing, and it needs to be on the death certificate as well. But there's pretty strict criteria to make sure that we're getting an accurate count and that everyone in our state is counting the same way.
Right.
The same thing the same way.
So I'm just curious, do you guys ever go deeper into like the details of the 700 deaths? So when you say 700 people have died attributed to COVID, do we know how many, like, do we know the age of the people? Was that, you know what I mean? Like, were there comorbidities that they were living with? How many were actually children versus elderly people, et cetera?
So yes, that we do have that data, and I'm happy to see what's shareable, and I can share that specific information.
No, for sure. I think like as you're talking and then you're giving that information, being able to really break this down in a health literacy way for the public is really, really important, right? Because I'm gonna be honest, I know for a fact if my mother and sister were sitting next to me and they heard attributed, that doesn't necessarily mean caused to people in like colloquial language, right? People don't know that. So it's really helpful to get as much information as possible and then have folks like us be able to, in a health literacy sense, like that public education aspect is super, super important. So that's where the trust is gone. That's why, because people don't understand. So thank you.
No, and I do want to share that that determining cause of death is complicated, especially for folks that have multiple comorbidities, and that we do see deaths in folks who contract COVID more commonly in folks that do have underlying comorbidities, and there's definitely an age component as well.
Right. Thank you.
And then just to folks' point about influenza vaccines, so just to contrast, statewide, about 30.4% of folks eligible for the flu vaccine received it last year. So compared to the 18.1% that are up to date on the who are up to date on COVID vaccine. We do continue to have clinics for COVID and influenza vaccination at the health department on Tuesdays and Thursdays. And folks that are covered are children and then uninsured and underinsured adults. And the details are on our website. And
I just have a question. We used to, pre-COVID, we used to be, offer them like for employees, for example, we used to have clinics for employees where we could offer, flu vaccine. And it was kind of easy because, you just brought in your health insurance and you were good to go. Are we gonna pick that back up again? And, I'm also looking at the atrium and looking at this location, right? Holding a clinic here where there's constant traffic of people accessing other services. Is that?
Yeah, we'd have to, part of this comes down to always money. I don't just mean the dollar amount, but also the eligibility of the people for the funding, right? So there's funding that we have that's available for children, funding for people who are, indigent care, so it's complicated. And so it's something I would be happy to check out with our program about what we currently have available and sort of how accessible is it, right? And whether or not we as a department have to, what relationship we need to continue to work through with, say, HCA or others about how to, so it's a little messier than I want it to be. But I do know the clinics we have now, a lot of that is based on our COVID funding we're getting from the state and from the feds. And it's got an eligibility requirement that we use there, but it's worth talking about and we're thinking about what do we what can we do beyond just those folks there?
You also asking about staff?
Oh, yeah.
Like a immunization clinic for staff?
Yeah, that's where I was going, was about, what I'm basically saying is people who have health insurance, there's a difference in sort of how we do the fund, like what we're offering and what we can accept.
Who pays for the vaccine?
Yeah.
Is it federally funded,
Yeah.
state funded, or privately?
But I think I would love to talk about, like, kind of figure out what's possible for us.
We have
but-
been doing vaccine clinics at my agency the last 2 years. We've done them outside. We had we had 2 in October, I think, because it's for, staff who all have PEB health insurance and their family members who are also covered by their insurance. And so we don't have to do the verification of eligibility. It's just the people who are already on the list. But it's, vaccinate a couple hundred people in our building. So it is an effective way of making sure people get the flu vaccine. We call it the Fluster, because we do the COVID booster and the flu. If we can get both vaccines online.
I was curious, I definitely think it's really important talking about the staff. I didn't even think about that. I put on vaccination clinics through the Urban League in Seattle on a regular basis. And so we utilize DOH Caravan. So I'm wondering whether or not that's an option to be able, because that's something free that we utilize. Everything we do is working off of grants, so there's always a cost. But when we find community partners and organizations that do things like that at no cost, we obviously try to partner with them as much as possible. So.
Yeah, that's possible. That DOH has been a good partner for us for a couple of areas. The Caravan has been kind of a unique resource that they started during COVID, and they're really thinking about trying to offer it up to local health jurisdictions or communities that are oftentimes don't have good access points, but they are getting pretty sophisticated and sort of being able to make requests of things. So but it's still a limited tool. They only have so many vans that go so many places.
I know, they had to tell me no a couple times recently,
no.
so.
And the state's supported efforts here before in the county, but I think it is worth us exploring and just sort of thinking about what it is we're capable of doing as a county for our county staff. I think it's a good question.
Are there any private companies like Birdseye and stuff that are still doing it that you might be able to contract to come in or something?
I'm not sure about that.
Birdseye does some, but I don't think they do them in Thurston County.
Yeah, I don't think either, but this is really worth us following up on.
Gone all over the place with Dr. A's report.
Yeah, we could
Yeah,
do
sorry.
it. The whole
Meander.
That's great.
I think those were the high points that I was hoping to cover today, and I'm happy to answer any additional questions.
I have a couple of questions. So with the self-serving testing kiosk in Tenino, which I went to the grand opening of it, I think the location is great. It's fantastic they're doing that. Are there any more planned locations in Thurston County?
Not right now. This is all based on us getting funding and grants from a partnership with the state and the company that created that. But I do know that I heard recently on a call with DOH that they're looking at doing another round. And so, of course, we'd be really interested as a county in participating in that.
That's pretty cool. And then my next question, as we got into the measles conversation, I think it would be good to also know about other diseases like STDs and just where we're at. COVID and it's very important, but having the rest of kind of where we're at in other sectors and seeing if there's a trend that we as a Board of Health need to be aware of, I think is very important as well.
That's great. It's 5 o'clock. I don't know if you could tell.
Yeah. We're locked in. Anything else, Dr. A?
I think those were the highlights for today, and I will bring an STI update for next meeting in addition if that works for folks.
That's great. Thank you. Now we have the director's report.
Yeah, I'm, again, standing between you and the end of your day, so I will be quick.
It's not the end of my day.
That's right, not for you. So really quickly, there's a bill number mentioned here, which is very mysterious looking. This was legislation that the county requested to enable the Board of Commissioners here in Thurston to have flexibility on how it selects members of the Board of Commissioners to the Board of Health. So right now, the law, prior to this bill, the law basically forced the county to have all 5 commissioners on the Board of Health without any sort of wiggle room. The short version of it, this bill will give the Board of Commissioners flexibility to choose, is it all 5? Do they decide there's 2 or 3? Every Board of Health across the state has a different dynamic when it comes to their elected officials. So this bill doesn't force the county in anything. What it does is it opens the door for future conversations for the Board of Commissioners to decide how do they want to sort of engage with the Board of Health in the future. And it gives it, instead of it being, again, requirement, and now you have the flexibility to decide like what that looks like. So that bill was passed, I think, unanimously through both chambers, and the governor will sign it tomorrow. I appreciate working with Commissioner Mincer and Commissioner Mejia to get that bill worked through. The other item on my list was a staff update, and I will start with a person in the back of the room, Jacqueline, and Jacqueline Gilly, and Jacqueline is our new Board of Health policy manager. She started yesterday, so I am not forcing her into managing this today, but she's here to observe and support Linda and the work right now. But I'm just so excited about this position, not only because this board needed a clerk role to support the administrative functions, but we're also looking, especially as you guys are looking at your strategic plan, and as a department, we're looking at making sure that we are active in the community and with the state and feds, someone who will help us with our policy side. So helping us track health policy legislation, helping us make sure that we are not missing opportunities with community partners. Like, this is gonna be a really exciting role. It's a brand new role that we created in the budget. So Jacqueline and I get to sort of make this up as we go along a little bit in some ways. But I'll tell you, it's also been a trend among some of our peer health jurisdictions to create policy positions. We're recognizing that our role in public health isn't just limited to this clinical aspects or limited to service aspects. We have to be engaged in policy. We have to be aware of what's happening in the state and also influence it. So really excited to have Jacqueline on board, and really appreciative of the Board of Commissioners and authorizing that in the budget. Related to that, we had a pretty significant budget ask. For those of you who've been here last year, we were really grateful for the state providing funding through their Foundational Public Health Services, and the board authorizing us to use that funding to support a variety of positions in the budget. And so I wanted to give you a quick status update where 3 months into the year, in terms of like where we are, and this is complicated because we have some positions that aren't authorized to start until either later in the year or next year. But of those that are authorized to start now, we had about 23 positions, and we have either hired or are in the process right now of negotiating the hire of 13 of those 23 positions, which is, I think, incredible.
That's great.
At this point.
That's very fast.
And I want to give, again, a huge shout out, not just to the hiring managers, but to our administrative services team and our budget team, and had to put together a well thought out plan in advance, and we're ready to go when January 1st hit. So this is really exciting for us. It's a lot of change for us, a lot of new faces, a lot of onboarding that's happening, and you're gonna kind of witness, I think, a department that is in transition in a really good way. But also we still need some patience as we get our growing pains out as well. But I am super excited. So my hope will be that, in about maybe 2 board meetings from now, we'll be able to sort of have all of it covered in terms of the positions we're authorized to have. But it's really exciting to see folks come on board. I feel like I see a new face in the department every week, and it's just been great. So want to just report on that, and again, give a special thank you to Lynn and Dr. Harvey for your work in supporting our budget ask. That was a big part of that. And then to the Board of Commissioners for actually authorizing it. So it's a fun update to give you guys. And that's it for me.
Thank you. One thing I wanted to mention, just as a reminder, is if you haven't yet taken your open public meetings, public records training yet, please do that and send your certificates to Rob. See some chuckles. I'll be open and say I haven't finished mine either, so I'm speaking to myself also. Ooh.
Dr.
Harvey has
Harvey is
it.
ready to go.
If you've taken it before, it lasts for 4 years, I believe.
Just did another one for another
Two.
committee, I'm assuming they
Your
transferred.
term, whatever your term is. You just did yours today?
For another committee, so I'm assuming it counts.
Every committee you're
Oh,
on,
good.
you have
It
to
still-
retake
it
the
still
training.
counts. You're good.
Oh, so you can do it once, but please get that done and then send your records over to either David or Rob, but we just gotta have those on record.
Right,
And there's an
that's-
online training that you can
Linda, 'cause
do.
she's the responsible one of us, yes.
Yes, I
Okay.
sent mine to.
Someone behind me waving, send it to Linda. Tracy, did you have a comment?
No, I was just pointing out
Oh,
Linda.
thank you. Everyone's cueing me for the person behind me. So on the list for next meeting, I believe we're gonna be hearing from the county emergency management staff. They're gonna bring us a presentation, and we'll wrap up our conversation on the strategic plan.
And we're also gonna invite members of some of these transgender advocacy communities and organizations to come.
All right. And more details on that agenda to come, but those are the broad strokes. Anything else for the good of the order? Dr. Harvey?
We have some collaboration going on tonight. So we have the schools, the county, and the providers meeting to try to work on all that communication in between all of them, and we're really excited.
That's wonderful. That's wonderful. That's great. Thank you so much. Doing the work of the Board of Health right here, getting it done. Okay. Can I get a motion to adjourn?
So moved.
All those in favor of adjourning?
Aye.
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 Okay, we are adjourned. Thank you, everybody.
Good having you.